The first thing that we're doing is we are asking patients to stay away from the primary care centre if at all possible. We are really trying to control who comes into the primary care centre. The aim of that is actually to protect patients from being in a crowd together and reducing their exposure, and also trying to protect the staff, the GPs and the nursing staff, as well as the PCC staff, from being accidentally exposed. The aim is to keep the service running as much as possible in as normal a way as possible, but obviously there are being changes implemented which will allow us to keep things running for as long as we can without people having to physically come down to the PCC site, which is the aim. When people actually come down to the PCC site, the first thing that they'll notice is that they'll be asked to wash their hands with the alcohol scrub. We've then got a nurse in place that will be checking their temperatures, and depending on where we go, we've separated our areas. We've got an area for patients that have not got any upper respiratory symptoms who would be low risk for COVID, and then we've got an area which is designated for patients with upper respiratory symptoms there's a small chance that we may have some COVID patients going in there. And we've also got a particular area to isolate patients with COVID so that we don't mix them into that unit. In terms of patients, they may be asked some questions, and it's important that they answer them fully and honestly and truthfully, so that will allow us to make sure that they are seen, if they need to be seen in the PCC, that they are seen in the safest place for them and for the staff. And it's important that people stick to that, because the reality of it is that if people are irresponsible and don't give us the information accurately, then we could be making decisions which could put everybody at risk. So it's really important. We're all in this together, and we need to act responsibly together for the benefit of everybody.
And those people at home with concerns, I've been told that 111 is the number for those who think they have some symptoms. What advice do you have for the use of the 111 number?
Okay, the use of the 111 number. The 111 number is actually a COVID dedicated line. Ideally, the 111 line should only be used by patients that have got upper respiratory type symptoms and have got any concerns wondering whether they have or haven't got COVID, and they've got protocols and things in place to deal with that. Unfortunately, what we're actually seeing in practice is that the 111 line is being used as a general helpline. I've got to ask the public to try and use the 111 line for COVID-related queries only, because there are a huge number of. I understand that that we're all concerned. This last weekend has been very, very upsetting and very, very scary for most of us, and unprecedented for Gibraltar, as the Chief Minister said. But the reality of it is that we need to restrict the use of the 111 line for COVID-related queries either. Otherwise, they will not be able to cope with the demand, and then we will run into difficulties.
And for those over 70s, the most at-risk age group who have been asked to stay at home but need something like an injection or the bandage changing, what should they be doing?
Yeah, well, basically the advice is to stay at home. If they get any problems, they need to contact us and let us know. But systems and services are being redeployed so that we will have teams of people that will actually be dealing with these individuals and actually attending to their needs in the home scenario. So we're also, in terms of this work being done, we're actually in the process of reorganizing ourselves in order to be able to deliver these services within the home setting and keeping them at home, which is a priority.